Hi, my name is Burdette, and this is Nursing 210. I'm about to do my exam on my patient of her eyes, ears, nose, heart, and lungs. And so the first thing that we're going to do is begin with a visual acuity. We're going to assume that that was already done using two different tests. The first test would be the Snelling test. We did the test at a distance of 20 feet, and we also did the Rosenbaum test. We held a card at a distance of 14 inches with her corrective lenses in her contacts. Her adjusted scores, if you will, were 20 over 20 on the Snelling test and 14 over 14 on the Rosenbaum test. Her corrective lenses appear to be working. The next thing that we're going to do is we're going to check her eyes using a pen light. I'm just going to shine this pen light in her eyes to make sure that I get a nice reflection back. So, okay. You can just look right here. There's a nice reflection coming back out of those eyes. Now I'm going to check her cardinal gaze. There's 6 points of the cardinal gaze that are going to check her cranial nerves. Cranial nerves number 3, number 4, as well as number 6. Cranial nerve number 3 being the ocular nerve, cranial nerve number 4 being the trochlear nerve, and cranial nerve number 6 being the abducens. So I'm just first going to have her look right here at my finger. Now I'm going to ask her to follow my pen light. So if you could just follow my pen light, just with your eyes. Very good. So her eyes went to all 6 positions with no issues, so that shows that cranial nerves are intact and working well. Okay, so the next thing that we're going to do is we are going to just take a look at the overall eye. Make sure that the eye is clear. The vitreous looks good. The globe is nice and white. Iris appear to be green in color. Eyelashes appear to be intact. Eyebrows appear to be well groomed. Pen light back down. Now I'm actually going to look into the eye itself. Okay, so if you just look right here at my finger. Now I was just checking there first to make sure that the pupils are equal, they are round, react, and they accommodate to the light. So now I'm going to look a little bit deeper into the eyes. The eye appears the optic disc. I was not able to actually see that, but the color of the eye was a red to an orange color. I did not notice any black spots. I did not notice any large areas that would indicate a hemorrhage. I'm just going to take one more look into the eye just to see if I can find or see that optic disc and make sure I can see the rest of the vessels, since I was unable to see it the first time. Unfortunately, I'm unable to see the optic, the disc. So what we're going to do now is we're just going to kind of palpate the eyes around the orbits and make sure everything is intact. So I'm just going to palpate. Any pain or pressure there?
No.
I'm going to feel the lacrimal duct on both sides that's present. Can I ask you to squint your eyes a little bit? Okay, open up. Okay, good. Perfect. Next we're gonna go ahead and move on to the ears. I'm gonna check the appearance of the ear. They appear to be setting equally on her head, normal in shape. The helix on both ears appear to be normal. Piercings are present in the lobes. Checking the mastoid, and behind the ear, there's no swelling or drainage, no erythema present. Everything to the external portion of the ear appears to be within the normal limits and intact. Just going to take a look inside the ear. You went okay?
Mm-hmm.
So in the left ear, the left ear appears to be clear. I was able to see the tympanic membrane, which appears to be gray, kind of a pearly white color. And actually, for the first time, I was able to see the cone of light, and so that was pretty good to see that. Now I'm going to check the other ear here. So the right ear appears to be intact. The ear canal itself is clear. The tympanic membrane, again, to the right ear is nice and pearly white, kind of a gray color, and a cone of light again was present. I'm gonna check her hearing, if you will, just with a whisper test. So if you're able to plug either ear, it doesn't matter. I'm going to whisper.
Mm-hmm.
All right, now if you could plug your other ear.
Yeah.
Okay. So the whisper test appears to be successful. We're going to move on to the Weber's test and check to see about the conduction. So what I'm going to do is I'm going to put this into play, make it vibrate and move. I'm just going to place this right on top of your head. You're going to tell me if you can hear it right, left, or both sides.
Okay. Both sides?
Both sides. Okay, perfect. I'm going to strike this again, and we're going to do a Rinna test. We're going to put this on your mastoid bone behind each ear, and you're going to tell me when you can no longer hear it, and then I'm going to take it off, and we're going to check to see if you can hear it just through the air.
Okay.
Can you hear that?
Okay. Yes.
Perfect. Okay, perfect. So she was unable, or I'm sorry, when she was no longer able to hear it through the conduction, we put it to air. She was able to continue to hear it through the air. And the conduction there is about 2 to 1 when you go from air being greater to the bone conduction. I guess that would be cranial nerve number 2.
Good job.
Okay. So we just checked cranial nerve number 2. We're gonna move on down to the nose and check cranial nerve number 1, which would be your olfactory nerve. Now, what I've done is I set up a she doesn't know what's in my container. So to check and see if her olfactory nerve is actually intact, I'm going to ask her to identify the smell that's in the container. So if you could close your eyes for me and just tell me.
Oh, coffee.
Coffee. There's coffee grounds in the bottom of my container. Thank you. I'm also going to get my gloves ready for the next portion of the test. But for right now, I'm just going to look at the nose itself, the structures of the nose. The external nares appear to be symmetrical, normal size, normal shape. Look inside your nose. Both sides. Do not notice any drainage or discharge, no redness, no erythema. We know that your nose is patent. You were able to smell the coffee. Any difficulties with breathing? No? Okay, perfect. The external portion of the nose appears to be intact, and again, did not notice any septum deviation. Gonna take a look inside her mouth and check mucous membranes and feel around in there a little bit. Alright, now if you are able to just open your mouth a little bit and take a peek inside there. Little light here. Lift your tongue up for me. Perfect. Okay. Alright. So as I was looking inside her mouth, I noticed her gums are nice and pink. Her teeth are intact, no loose teeth, no pain with palpation. Her lips pink, they're moist,